Hello friends, I'm Satish inviting you in our show StemRx Beyond the Hopes. So today we are going to discuss about the topic infertility, and in that we are going to discuss about male infertility. To discuss that topic we are having Dr. Pallavi with us. Welcome Dr. Pallavi to our show. In the beginning I would like to say you that please introduce yourself to our viewers so they can know about you.
Yeah, thank you, Satish. I'm Dr. Pallavi Lale. I'm MBBS MD. I'm infertility expert here in StemRx. Also, I'm cosmetic surgeon, regenerative medicine consultant, and laparoscopic surgeon as well. And I'm working in this field since 9 years.
So, doctors, today we are going to discuss about infertility, and in that we are discussing male infertility. So, my first question will be, what is infertility?
Yeah. So infertility is said to be happen when a couple is trying for 1 year for getting conceived
Yeah.
without using any contraceptives like USI pills or intrauterine devices like copper T or any barrier contraceptive like condoms. And they are repeatedly coming in contact, but pregnancy is not going to happen. Then we can say it is infertility.
Okay. Whenever we are discussing about infertility, we are thinking this is related to females or women, but clinical studies are showing that so many cases are happening with males. So, male infertility. What is male infertility?
Yeah, you said it rightly. Actually, male and female are equally contributing to the infertility. Like you can say 40% of the male and 40% times the female is contributing for the infertility, and of course 20% remaining are unexplained infertility.
Yeah.
So coming to the point, what is male infertility is the most important because most of the people don't even aware about this. So male infertility is when the patient is unable to conceive even after 1 year without using contraception, obviously. And when we do the proper investigation of male and female, and of course in female there is no any conditions going for the infertility, but male showing some symptoms, you can say, or some blood investigation and semen analysis show that there is no sperms in the semen, then we can call it as a male infertility.
So, what will be the reasons for that?
There are so many reasons for male infertility. So first of all, we can say if there is any structural abnormality in the reproductive system of male, like you can say if it is any problem in the testes or the complete pathway from which the semen come out of the body, ejaculated outside the body. If there is any obstruction, then we can call it as obstructive infertility as well. Then there is a other problem like environmental factors. If the male is working in very hot environment, see, so there may be a problem in the spermatogenesis. So defective sperm may be there or less quantity of sperm may be there. Other things, certain males have some addiction as well, like alcohol or smoking, that may also affect to the sperm quality and quantity. There is also reason like hormonal imbalance. So if there is a hyperthyroidism or hyperprolactinemia, this also may lead to the infertility, male infertility. Then certain other things are there like chromosomal abnormalities also leads to the infertility. Then our lifestyle changes also play a very important role in infertility, like what our sedentary lifestyle is there. If there is obesity, it can also lead to the hypertension or diabetes. They can also tends to the azoospermia.
So, is there any treatment for this, or we can say, is it curable?
Yeah, because if we talk about the azoospermia may be of two types, maybe obstructive or non-obstructive. So if it is obstructive, then you can say the sperms are getting produced inside the testes, but they are not coming outside. So nowadays many IVF centers run certain investigations or tests, or you can say the treatment like TESA and PESA from which we can take out the sperms directly from the testes with the help of needle. And then in IVF lab, we usually introduce these sperms inside the oocyte and fertilize them, which procedure is also called as ICSI. So, but the thing is non-obstructive azoospermia, where the sperms are not getting produced inside the testes. But nowadays, with the recent advances in the science, there is also a hope for that patient as well to produce the sperms in the patient's body with the help of regenerative medicine.
Okay. So the word regenerative medicine. I'm going to ask the same question you that what is regenerative medicine?
So yeah, this word is very much new for our patients as well. What is regenerative medicine? To make the awareness in the patients, as there is a hope for them to become a father of their own biological child, their whole chromosomal pattern.
Yeah.
So regenerative medicine is this thing where we can take the help of our own body's tissue to form the sperms inside the testes.
Yes.
So what are these cells? You must be wondering about that.
Yeah.
But these are certain mesenchymal stem cells, we can say, which have capacity to regenerate into any kind of cells. They can multiply into any kind of cells. They have healing capacity, they have anti-inflammatory capacity, anti-fibrotic capacity, and anti-apoptotic capacity. I know these words are very high level for a patient to understand,
Yeah.
but there is this each and every word has their own meaning. They are very important in healing your, if there is any inflammatory condition inside your body, so they are going to help you in reducing inflammation. If there is any disease inside your body or in testes, say, or in epididymis, so they have capacity to reheal that structure. And they also have capacity of anti-apoptosis, means if these tissues are going to death, they help to prevent from the damage.
Yes.
So with the help of this, we can take this benefit in producing the sperms. Also, apart from this mesenchymal stem cell, like PRP is also very good source. It is also a part of regenerative medicine because it is very rich in certain growth factors, cytokines, and interleukins, which play a very important role for the autoimmune diseases.
Okay.
So it helps you in building your immunity as well. So regenerative medicine is a very good hope for those patients who are suffering from non-obstructive azoospermia.
Yeah, you are going giving us a good hope, but what I want to ask you that you have the treatment for this, but what are the precautions that it will not happen to anybody?
So this is very good question you are asking, because we know what are the causes for azoospermia, you can say, or male infertility.
Yeah.
So we need to avoid that conditions. Like if you are working in a very hot environment, you need to avoid certain conditions where the hot environment is there. Taking long time sauna baths you can avoid. So much strenuous exercises you can avoid, because they are going to decrease the testosterone hormone, which is important for the spermatogenesis. Then you can take a very good diet, so that it is rich in antioxidants. Anti-inflammatory diet should be there, like fried things you should be avoided. Then gluten-free diet should be there.
Yes.
And apart from that, you do the exercises, but in a moderate quantity, so that there is no obesity as well. So because obesity is also one of the reason to lead for diabetes and hypertension, so you need to do that things as well. Other thing is, if any patient is addictive, so he need to stop the smoking or alcoholism. That things we can do certain changes in our lifestyle, and we can benefit it from that.
So with this hope that with the help of regenerative medicines we can treat male infertility, we are going to finish this show. Thank you, Dr. Pallavi, for coming on our session. We will be definitely meeting for new reasons and new conditions in next episode. Thank you very much.
Thank you.